Hi guys, in this class we'll learn about the etiological factors of diabetes mellitus. First, genetic. There is a familial tendency to develop type 1 diabetes, altered frequency of certain HLE antigen, foreign substance that produces antibodies on chromosome 6, abnormal immune response, autoimmunity and islet cell antibodies are noted. Second one is age. This disease can occur at any age. Sex. In younger group, males are prone, but females are more affiliated in great numbers. Dietary factors. Low intake of fiber in the diet is associated with diabetes. Excessive food or excess food, especially refined food, cause the energy imbalance and lead to obesity, a risk factor for diabetes. Infection. Viral infections such as measles and mumps can trigger abnormal autoimmune response that destroy beta cells of pancreas which produces insulin. As I think all of you guys know autoimmune response. Autoimmunity is nothing but our own cells are attacked by our own attacked by our own body's immune response. That means the lymphocyte, B lymphocytes and antibody all think our body cells, that means B cells or beta cells of pancreas and every cells as the antigens or foreign substances. So they attack our cells, which leads to destruction of beta cells, which produces insulin. Increased catabolism, excessive breakdown of liver sugar or glycogen, tissues, protein and fat breakdown cause metabolic changes, cause diabetes. Stress is a contributing factor in precipitating this disorder, type 2 diabetes. Beside these, there are some imbalance of hormones also, which leads to insulin antagonist. First one, growth hormone. About 1/3 of diabetes have shown excess growth hormone. Adrenocortical hormone, cortisol or corticosteroids lead to increased protein breakdown and inhibit sugar utilization by tissue, thus increasing blood sugar levels. Adrenaline. This hormone increases the breakdown of glycogen, that storage form of glucose in liver. It suppresses insulin secretions, thus increasing the blood sugar level. Thyroid hormone. Excess thyroid hormone aggravates diabetes. Besides imbalance of hormone, diseases could be to an etiological factors. Some other factors are in aging, a very important cause of diabetes could be underlying tissue or underlying diseases. Diabetes occurs secondary to some other diseases which may lead insulin insensitivity or impaired secretion of insulin. These diseases as pancreatitis, that is inflammation of pancreas, carcinoma of pancreas or pancreectomy, which means surgery of pancreatic duct. Mostly type 2 diabetes shows insulin resistance. Gestational diabetes. It is a temporary diabetes seen in pregnancy. It is due to increased production of hormones which are antagonists to insulin production. As we have seen, the growth hormone and adrenocortical hormone, adrenal, these all act as antagonist to insulin production. So we will observe temporary diabetes in the pregnancy woman, which is called a gestational diabetes. Excess food, lack of exercise, aging or environmental factors for diabetes mellitus. Now we'll see factors affecting normal blood sugar levels. Already we have learnt about insulin is the most important factor responsible for normal blood sugar levels, and we will learn about the various factors that can increase the blood sugar levels and that can reduce it. First of all, we will know the normal ranges of sugar levels in the blood, which is 80 to 110 mg per 100 ml. This is the fasting level also. Now we will see factors that increase blood levels. Blood sugar levels, normal or fasting sugar level, 80 to 110 mg per dl. Factors increasing blood sugar level, hormones like, as I already said, anterior pituitary hormones, thyroid, adrenal, liver glycogen breakdown, protein catabolism, intestinal sugar absorption. Factors decreasing blood sugar levels means which is in exercise, insulin, liver storage, fat formation, kidney threshold. Okay, I'll explain it in next classes. We have learned about insufficient production of or insulin resistance can cause diabetes, which is commonly called as primary diabetes. Factors that increase sugar levels like hormones, intestinal disorders, uh, diseases in which heavy breakdown of proteins, which means stress and trauma, dietary habits, lack of exercise, metabolic disorders, and everything, sometimes impaired glucose tolerance also. Next, diabetes occurs due to factors other than insulin is called secondary diabetes, which is multifactorial. Most common form which we observe is primary diabetes.